Hi, good morning, everyone. We're about 2 minutes till time, and we're going to give others just a few more minutes to join. Please bear with us. Give us about 5 more minutes. Thank you. Hi, good morning, everyone. Thank you for joining the Georgia Clinical Quality Measure System Georgia CQMS webinar. My name is Christy Washington with DCH, and I'll be your moderator for this webinar. Jeff Jacobs with DXC Technology will present an overview of the program, followed by a system presentation by Winner Laws from DXC. This presentation will show the system capabilities and functionalities, including how to enter clinical measures data and generating provider performance comparison reports. I would like to remind everyone of a couple of housekeeping rules. Please hold all questions until the question and answer session. At that time, please raise your hand and you will be unmuted to ask your question, or you can use the type your question in the question pane and we'll read your question aloud. This presentation is also available for downloading. You'll find it located in the handouts pane. And if you're unable to download it, please send an email to hit.info@dch.ga.gov. Again, that is at hit.info@dch.ga.gov. And we'll be happy to send you a copy. And at this time, I will turn the webinar over to Jeff Jacobs.
Okay, good morning, everyone. Thanks so much for your time. A couple of other mentions. We do have all of the lines muted, and that's to help make sure we suppress any background noise. And then when Christy referenced raising your hands, I'm thinking of people in their office raising their hands And so we do have a great camera feature where we can see everybody in their offices. No, we have an online hand-raising feature there in the webinar that you can use. So please take advantage of that. All righty. Well, again, thanks for your time. I think we've got, did we have 2 or 3 hours lined up for this? No, this we'll be efficient with our time here, and we're excited about the project and sharing with you. So here you see the department's mission, and we certainly see the project as aligned nicely where we're looking to support the goal of a healthy Georgia. And so for our agenda today, again, Christy mentioned I'm Jeff Jacobs with DXC Technology. We serve as the fiscal agent and also partner with Health Tech Solutions and DCH in delivering this solution. We're going to give you an overview, run through some benefits. We'll show you the system. Dr. Dan Roach from Health Tech Solutions is on to provide a clinical perspective, and then we'll open it up for any question and answer. So, so the system that we're wanting to share with you and talk about today is a project that the HIT team has undertaken that really is looking to implement and operationalize. So we've implemented, right, and now we're looking to operationalize a way to accept clinical quality measurement data from providers through created out of their EHR systems. And so, you know, our goal with that, right, is to assess that data, see what kind of trends come out, assess it against various benchmarks, maybe disease categories, geographies, subset of different provider types, a number of different ways, right? And so we've got sort of a phased approach. Our real goal at this phase in the project is really all about seeking participation from volunteer organizations and to identify what lessons learned or opportunities we may have when it comes to getting folks onboarded and participating in the project. I do want to mention for our panelist team, for our panelist folks, we do not have those lines muted, so if folks will maybe mute their phones if you're part of our panelist team, and that way we'll avoid hearing any background noise. Now, we do have a little group participation to keep this exciting, and so we've got a couple of polls that we want to ask you to participate in. I know that everybody loves participating in polls. We will not ask you who you're voting for, but we'll ask questions maybe a little bit more germane to our project. And so first up, our question, is your practice currently looking for an effective way to capture clinical quality measurement? Is your practice currently looking for an effective way to capture clinical quality measures? And so we have a little poll response option available to you where you can just click yes or no in the GoToWebinar app. And so we'll give everybody a minute to vote here. And I think we've got right around 25 folks participating. And so just about everybody's voted. We're headed above 60%. Thank you. And so our poll results have stayed pretty consistent, it looks like. And so it's the old 80-20 rule, I guess, in that we've got 81% indicating that, yes, they are looking for an effective way to capture clinical quality measures. And so we're excited to see that response, and that's great. Okay, so thank you for your participation in that. We'll be back with more questions soon. Okay, so our project benefits, right? And so these really just aligned with the kind of goals that you would expect the department to have, focused on improved health outcomes for Medicaid members, very much seeking to align with CMS direction and efforts that they have. Of course, they've been collecting clinical quality measures through some of their quality programs for years. And so our hope is to follow a similar path and gain lessons learned from challenges related to gathering that data. And we'll share with you later some of the changes that we've made in these initial phases, where our goal for this project and for anybody that participates is to keep the time commitment limited, right? We know that you have a great deal of requests and requirements on your plate, your day jobs, and so this is very much about seeking your participation, if interested, in and making that participation labor-intensive light, right? So what we're doing is creating a platform that will enable the department, give transparency to participants, an opportunity to really in a consistent way using standards, right? CMS standard clinical quality measures to evaluate the effectiveness of the services being provided. You know, I think we'll hear later about, you know, value-based purchasing initiatives, but ultimately the focus is improved health outcomes. How can we identify where there might be opportunities or areas for improvement? Maybe those are program changes, maybe those are outreach changes, maybe those are initiatives that the department undertakes specific to a geography, specific to a disease state. We'll see. You see at the bottom a familiar focus on better care, smarter spending, and healthier folks through our information sharing and our care delivery. Hey, it's poll question time again, and so let's come back to the poll. Would comparing provider data to a state average data benefit your practice? And this is a great question because this is exactly what we've got the capability to support. So would comparing individual provider data to state average data benefit your practice? And so we'll give you a second there to respond. Now, do we have to change? We don't change the question in that. Okay, so that is the question. Okay, so this is another great response. We're getting heading up there above 60% again. Again, we're a little better than the 80-20 rule this time. We're close to 90%, and certainly we would agree that there's great opportunity and value in having some transparency around that data, and that transparency, when we refer to that, is really transparency for your team, for your providers to be able to assess how they compare against state averages. And of course, the department can see that data as well. Okay, so let's talk specifically about what the project involves, right? So we really engage with providers directly to leverage data out of certified EHR systems. A lot of folks have been participating in what we refer to as MAPR, or the Meaningful Use Project, or promoting interoperability, as it has recently been renamed, where there have been incentive payments made for certified EHR systems. Within each of those systems, they have the ability to generate reports, to generate electronic files that can be distributed that report CQM data and measurement data. If you've ever seen those measurements when they come out, you might notice the reference here to a QRD Category 3. That is clinical quality measure data at an aggregate level. So our project at this point is not focused on individual member adherence performance measurement. It's really looking at aggregate level reporting. So the metrics that we gather are very much a numerator value, a denominator value, and any exclusions or exceptions that may be applicable to a specific measure. And so that's really the kind of data that is shared out of the QRDA file. And again, that's just the electronic file reference to the HL7 file type. You know, you might think of that in the same way you think of an 837 for a claims transaction, or a 270, 271 for an eligibility transaction. This would be a transaction that communicates clinical quality measures. Or we also accept manual entry of the data. And we have one of our early lessons learned was one of our opportunities to encourage support and support the provider community and offices was to also offer an option where we'd enter the data. So if you've got multiple providers, if you got one provider, it's pretty very simple to enter that data. If you have multiple providers, you might appreciate help entering that data, and we're available to do that. And the great thing about it is it then sends a report to you so that you can see the data that was entered and verify that, yes, they captured my information as I sent it. So the system then displays the measurement data through a dashboard capability, and we're going to show you a little bit of that when we do a demo of the system here in a minute. And we talked a little bit about the assistance of a data entry clerk. We also have a clinical advisory board group that supports the project, really a number of clinicians and physicians supporting the group, giving advice, recommendations, giving some insight based on their current practice. And as you can imagine, they've also helped us focus on, we need to make this as light an impact to day-to-day efforts as possible. And you'll hear us at one point talk about the time involved. Really, we meet with you, we share the capabilities of the system, we issue an ID, and then collection of the data can be something as simple as giving us an electronic file, or entering the data online, or we enter it for you. That's about the extent of it. Right now, we're focused on quarterly collection of that data. And so we appreciate the participation of the advisory board, and we'll hear from one of those members at the tail end of the call. Okay, hey, it's poll time. Back by popular demand. Question number 3, would you utilize trend analysis or reporting to monitor population health? Would you utilize trend analysis or reporting to monitor population health? And so this very much the focus of our project is to use standard clinical quality measures in making assessments about the health of our various constituencies. We'll give everybody another second there. Okay. Well, again, in the 90s, and we certainly concur as well. We feel like having visibility to trends over time is helpful, and to be able to use those trends in a couple of different context ways in terms of disease categories or geographies is very helpful. So we're not looking for a huge group. This is not a project that's going to have 1,000 people participating. Very much focused on wanting to connect with you individually as an organization. Right now we've got 7 participating provider organizations. Some of those have dozens of providers participating. Some of those have a single provider or 2 or 3 providers. We currently have 7 CQMs in the system, although one of those will be removed. We're going to show you that list in just a second. And then we do hope that we can collect the data on a quarterly basis. One of the things that we saw in a recent upload was the data was only available on an annual level. And so we've taken that into consideration for next steps. So let's share with you a little bit about the detail of those quality measures. And so these are the 7, changing to 6 that we currently support. They're pretty broad. They're pretty typical for a lot of office visits. And then there are some specific targeted areas, included some behavioral health, mental health items as well. And we're going to grow this list. So the next screen shares what's coming soon. And so these are additional measures. Have added a number of children-based measures that will help some of the participation of those interested who may have a pediatric practice. Number 154 is very timely. With pollen starting to hit the air, I suspect that'll be a common treatment activity. It often is in my household. I don't think we planned any personal observation time, so I'll move on. But these are the measures that we're adding. We are open to adding more, so if your office is interested in participating but you didn't see a measure that you feel like you might report a lot on, we'd love that feedback. And so again, this is a very interactive project. A lot of the changes that we made, a lot of the modifications that have been suggested, those come in to the project team, to the clinical advisory board, and we try to incorporate that where we can. Okay, and so we've covered the coming soon. Our last poll question of the day, I hear the moan in the audience, disappointment that it's the last question of the day, but then it's demo time, so that's the good stuff. So let's see the system. So last question, has your practice had any conversations with your EHR vendor about QRDA files or the ability to capture and share clinical quality measures through electronic files? So has your practice spoken to your EHR vendor about QRDA files? And again, that's just another way of saying those electronic files that generate out of the EHR system and allow you to report clinical quality measures through a EDI transaction rather than having to enter anything manually. Okay, so this is about 50-50. So that's good to know. That's one thing that we have found interesting. You know, many of these certified EHR systems really need to be able to generate these files as part of their functionality. We have found that in some cases with some of the vendors we've talked to, they've got it on their roadmap. So that translates to they're not quite there today, but they can generate a report. And so again, the good news for our project is we can support either direction, whether it's an electronic file or a manual version. Again, we're going to open it up for Q&A. So if you've been wishing you could pose a question, we're gonna open that up at the end, and we can go back and cover and talk about any particular detail if anything has not been clear. So I'm going to ask Winter Laws, who is our project leader on the DXC side, to share with us a little bit about the system directly.
Thank you, Jeff. I appreciate that. And welcome to the call, everyone. We do have a few slides that will show you the capabilities of our system. Next slide, please. The initial slide has a log on, and once you're registered and approved, you as a user will have a secure log on into the GA CQMS system with a provider log on and a password. Next slide, please. As a registered provider, once logged into the GA CQMS, the dashboard will be displayed, as you can see here. This dashboard will display the CQM measure statistics for the current year and quarter. The graph shows a comparison between the CQM data you have entered with the state average. To see how well you are trending with the CQM, you could click the CQM itself and look at an awesome trend graph, which will be displayed. Next slide, please. As you can see here, the trend graph will show trending with the state average, your specific CQM. This particular one talks about chlamydia screening, CMS 153, and in the black would be your measure, and the state average is in the blue. Next slide, please. In the next slide, you'll see a chlamydia screening, and it's divided by two different types of categories: patient age 16 through 20 and patient age 21 through 24. And so you can see the split down there between, again, the black would be my average as a provider compared to the state average as compared to the state average. Next slide, please. The additional thing that this particular system could do is there are two options to enter in the CQM data: the manual entry, of which Jeff spoke about a little bit earlier, and then the QRDA Cat3 file, which we can do it from electronically. Next slide, please. The manual entry will require to enter the numerator, denominator, and sometimes the exclusion or exception, depending upon the CQM. It's very easy to do to enter the CQM data. DXC is currently available to assist with the manual entry, entering the CQM data upon request, which is, again, something Jeff mentioned a little bit earlier. Next slide, please. Once you complete the entry of the CQM data, the View CQM Details screen will display a summary of the information that you entered. And as you can see here, there is a scenario of all of the various CQMs for this particular provider that's out there, and it's got the CMS ID 69, 122, etc. The thing I would like for you to observe at this point, it has at the top View CQM Details, and to the rightmost of the screen, you'll see it has a printable version of this data, and you could also export it into Excel if you like. Next slide, please. At this time, Dr. Dan Roach will be sharing the clinical perspective. Dr. Matthew has been delayed or impacted by a plane flight. Dr. Dan Roach has assisted with state and federal information technology policies to give them unique solutions to meet the diverse needs of the client. He understands the barriers to the provider adoption of the health information technology and has worked as a physician advocate to help the provider community with these type of technology changes. Dr. Roach, please.
Good morning. Thank you, Winter. And at the risk of being slightly awkward, Dr. Matthew actually made the call and has been messaging me. So he is actually available if you guys would like for him to go ahead and you know, continue with his prepared remarks. I think he had quite a few things to talk about, actually. Would that be okay?
Yeah,
I think that's fine. Great.
Thank you, everyone. And I do want to leave a little time for Dr. Roach. Dr. Roach, thanks for being so gracious for stepping in. I wish I had a little more control over my flight, but obviously I'm not a pilot. But I did want to talk to folks on the call today and mention a few things. As you know, Georgia is actually on the forefront of what this whole movement is towards value-based care. It's a big change. It's been going on for probably, what, the better part of 8-9 years. But as the government is seeing more and more cost savings from it, there's a concern, quite honestly, that with success comes more of a spread and adoption of value-based care. And while many states have been using it to try to show better outcomes, there is also the push towards cost savings. I think as we are seeing movements in the federal government towards the Affordable Care Act and how Medicaid will start being pushed towards block grants, there's a chance that things are going to be pushed onto states versus having the states design them on their own. So why would I say this? Georgia is part of the lead group of states that's been trying to figure out how to make value-based care work. And, you know, there's a lot of aspirations for this type of program. We want to try to reach out to long-term care providers, behavioral health, pediatrics, maternal fetal health, social determinants of health. These are all great things. But for any of this to work, we need people in the field with feet on the ground seeing patients, telling us what works and what doesn't. And I think that's been missing in a lot of the policy that's being pushed down from top. And that's why a program like the CQMS program is so important. The work the physicians are doing in the field, seeing patients and giving feedback to us so we can create something that's useful, that takes some of the barriers away from seeing patients, is vital, so that when Georgia has to respond back to the federal government for funding, it's coming from real life experience and problems that we're seeing in the field versus a bunch of folks in an ivory tower talking about what they think might happen. And I think that's where the strength for the CQMS program really comes. The fact that we are leading the charge and trying to get people involved instead of just designing it and just assuming people will adopt it, as many technology companies in the healthcare field have done over the last couple of decades. So again, that's one of the reasons I'm on board, along with obviously the rest of the board, like Dr. Roach, where we're trying to advise it from a clinical perspective. I still work as part-time as a hospitalist at the local level 1 trauma center, and I try to take that insight to wherever I go. I'm not in the field as much as most of the folks here, but my hope is by working together, we can shape this program to make something good for Georgia and its Medicaid folks. That's all I had. Dr. Roach?
Yeah, I would just like to add that, as a physician and also as a builder of systems and a, solutions developer, I think if you're going to be measured against something, if you're going to be held accountable to something, you ought to be able to have a way to measure yourself and to see how you're doing. If someone else is going to be measuring you, you should be able to do it yourself. And so we want to make sure these systems are built in a way that are useful. And I think that, again, is part of the experiment here, is to make sure that it's information that is not, it's useful, it's helpful, and it's actionable. You can actually do something with it to improve your practice and to improve your value, and then these value-based reimbursement models, so that you can maximize reimbursement and that sort of thing. So I think I come to it from that perspective, not an oversight perspective, but let's provide tools that are actually helpful to help you get through this repayment model world that we're going into.
Okay, so thank you so much, Dr. Roach and Dr. Matthew, and really appreciate y'all adding your perspective and insight. So good to have you both participating in the project. Okay, so I think now we're going to take everybody off mute, right? So all the lines will come off mute, or Christy, how do we do that? We're looking for folks to raise their hand, and we'll take individuals off mute. How do we do that?
Yes, we'll look for them to raise their hand. They can put their question in the question pane or raise your hand, and we'll unmute you.
Okay, so we are looking for any hands up. And we are looking good on schedule, so we'll take a second here. Okay, not seeing any questions at this point. So let us share a couple of more data points, and then we'll come back for any additional questions. So on the next slide, we're sharing with you an email address and a phone number. So we do hope that you might be interested, that your organization might be interested in participating in the project. And so just in case you're hearing only and not able to see the screen, it's GA CQMs at dxc.com. You don't have to commit to participating. You can just indicate, hey, I'd like to learn more. If you'd like to schedule a one-on-one call with your team, we're happy to do that. And you can also reach out to us via phone at 866-211-0949. Again, 866-211-0949. Our hope is to identify additional participants to register you and to have you participate. Again, our activity, it looks a lot like a brief training session. We issue IDs, we collect some of the initial data. There's not an enrollment application of any kind. It's really a very simple registration of provider information. If you have a larger group, we've actually identified ways that we can automate some of that load. And so again, sort of coming back to this theme of looking for ways to try to make it as light a lift on the organization participating as possible. Our goal is to collect data quarterly, so we're collecting in the current quarter for the prior quarter. When you submit that data within the quarter is driven by what's best for the organization participating. Again, we expect that to require a limited amount of time, generating the measurement data out of your EHR system and then either transmitting it, manually entering it, or sending it to us for us to manually enter for you. And then that information, full transparency to that information of exactly how that information shows up is available through those dashboards that Winter showed a little bit earlier. So please reach out to us if interested in participating. We are also going to be at the Medicaid Fair in April. So if those of you that are familiar, twice a year, we do a Medicaid fair typically in the Atlanta area and often in another location, sometimes in one of my favorite places, Athens, Georgia. But this time we're in Savannah, another beautiful place to be. And so we're going to be in Savannah on April 23rd. We'll have a table at the Medicaid Fair. If you just want to come talk to us at the Medicaid Fair, we'd love to talk to you there. And so, again, we want to meet you where you have interest. And so I think that covers the meat of it. Let's go back and check to see if there's any additional questions. Since we do have a little bit of time, I can cover some of the Georgia Bulldog fall schedule and what that's looking like. No, the room here is indicating that's not a good idea. So I'll pull back from that, and we will thank you for your participation and time. Know you're busy, but really appreciate you taking time to spend with us today, and we hope that we'll hear from you and go to next steps. We do have a survey. Christy, can you help me with that? It's within the application? Okay. So as the webinar concludes, we'll have a survey. We'd love to get your feedback. And so please take a moment and share feedback on the survey. Thanks again.